The Intersectionality of Gender and Disability by Anna Mori. What is gender? As we have learned throughout this course, gender is a social construct in which we define our lives by masculinity and femininity. We gender almost everything in our lives, from jobs to genres of movies to disability. The way we treat people with disabilities depends on their gender, including how they are treated, sexualized, and diagnosed. Throughout this presentation, I will describe the differential treatment of men and women with disabilities, my experience working with children with autism spectrum disorder, and the way in which ASD is disproportionately diagnosed among girls and boys. What is disability? The definition of disability has changed drastically over the years. According to Muhammad and Sheffer, most current definitions of disability include physical impairments, mental and learning impairments, sensory impairments, and emotional and psychological impairments. In the article, Disability Studies and Interdisciplinary Introduction, Goodley identifies that 10% of the population has a disability. Of these disabilities, 97% of them were acquired throughout the individual's life. Disability in women. In the article Disability, Poverty, Gender, and Race, Emmett describes that disabled women are undereducated and poorer than their male counterparts. They are desexualized and have higher risk of sexual abuse. Disabled women are at an increased disadvantage in the workplace by being both a woman and disabled. In general, women make less money than men. However, disabled women earn less money than able-bodied women in the same position. Women with disabilities are less likely to be employed and paid less than disabled men. In an education setting, there is an equal ratio of boys to girls. However, in special education, boys make up 2/3 of the population. In special education, girls have a higher academic status than boys. However, after graduation, girls were still employed less, earning less, and less likely to pursue higher education. Due to the lower wages and higher unemployment, disabled women are more likely to be living in poverty than disabled men. Society's expectations of men and women. In American culture, it is socially expected for men to be assertive and for women to be attractive. In the 4th chapter of the gender textbook, it describes that men who are disabled often feel demasculated, while women who are disabled feel unattractive. There is a social pressure for men to protect others as well as have exciting sex lives. Depending on the disability, both of these expectations can differ from an individual's ability. Women are often desexualized and feel that they have to hyper-perform femininity in order to meet society's expectations. Not only are society's expectations of men and women different from those with disabilities, but society also conforms to individuals with disabilities. Able-bodied individuals treat people with disabilities differently, often by pitying them, trying to make their lives easier, and treating them as if they were children. Carrie, the author of Know Me Where It Hurts, Sex, Kink, and Cerebral Palsy, describes that having a sex life can be difficult because it is hard to believe that their body is deserving of pleasure. Many individuals with disabilities have a difficult time believing that they are attractive and capable enough to have sex lives, and that they are deserving of the same pleasure as able-bodied individuals. Autism and Gender 101. In the YouTube video Autism and Gender 101, My Trans Non-Binary Autistic Experience with Audi Gender, provided in Module 2, Lyric Rivera describes their experience with autism and gender. As previously discussed, gender is a social construct, and an identifying factor of autism is the struggle to conform with social constructs. Lyric explained that individuals with autism don't fit neatly within a box. This also translates over to gender, considering that much of society expects people to conform to the gender binary. In the past 2 years, I've worked as a paraprofessional at an elementary school, and I am currently working at a day treatment program for children with autism spectrum disorder. In the elementary school and at the day treatment program in both the morning and afternoon sessions, there is a disproportionate amount of boys compared to girls. Disproportionate diagnosis of autism continued. Autism spectrum disorder, or ASD, is a developmental disability that affects social interaction, verbal ability, repetitive behaviors, or restricted interests. In my experience, this can look like flapping of the hands, oral fixation, emotional dysregulation, lacking communication skills, or being nonverbal. There is also a higher prevalence of physical aggression, including biting, hitting, spitting, scratching, and kicking. According to the CDC, boys were 3.4 times more likely than girls to be diagnosed with autism spectrum disorder. The lowest rates of ASD diagnoses were among non-Hispanic white children, and the highest rates of diagnoses were among Asian or Pacific Islanders, followed by American Indian or Alaskan Native, non-Hispanic Black or African American, Hispanic or Latino, and multiracial children. Gender bias in autism spectrum disorder diagnosis. Autism was previously considered to be more prominent in males. However, there is evidence that the criteria to diagnose autism is gender biased, leading many females to be underdiagnosed or misdiagnosed. Diagnosis of girls can be more difficult because they tend to show higher social skills compared to boys. Because of this, females are less likely to be referred to doctors for evaluation or to be misdiagnosed. Girls tend to internalize distress, leading to diagnoses of anxiety, mood, or eating disorders, versus males externalize their distress, leading to aggression. Due to the underdiagnosis and misdiagnosis of autism in girls, much of what we know and understand about autism is how it affects boys. Many of the diagnostic tools that have been created were made to be used on boys primarily because their externalizing of distress is seen as socially unacceptable behaviors. Food for thought. The intersectionality of gender and disability has proven to have negative consequences for men and women. Women with autism experience a higher rate of misdiagnosis and underdiagnosis compared to men due to the diagnostic tools being constructed for men. How many other disabilities are misdiagnosed and underdiagnosed in women because diagnostic tools have historically been focused on men? Within society, individuals are expected to conform to social constructs. However, individuals with disabilities diverge from these norms. The way in which society treats individuals with disabilities varies from the extent of the disability and the gender of the individual. We expect men to be masculine and women to be feminine. However, when men have disabilities, society demasculates them, and when women have disabilities, they're viewed as less attractive. How do you treat individuals with disabilities? Do you view them as less of a man or a woman because they are disabled?